Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Wednesday, January 27th. I appreciate your patience a little bit today as we pushed back the COVID update. Had a conference call with one of our advisory board members just talking about COVID-19, talking about the election and the impact of some of the federal and state legislation on COVID and on rural independent hospitals especially. So we wanted to make sure we participated and we got our story out there. So thank you for your patience today. Let's get right to the numbers. And, continuing to see the decline. And it's not just Titus, it's across the nation, it's across the state. Got asked the other day, and I appreciate your comments on Facebooks, and I appreciate the people watching. And it's good to see my mom watching. So I see the Betty Scoggin up there, and it's good to see her as she recuperates from COVID-19. I see her getting stronger and stronger. So now she can open up her computer. So that's fun to watch. But when we start looking at the numbers, one of the questions I keep getting asked is the vaccine helping or is it going away? Is it the light at the end of the tunnel? Are we done? Well, it's a combination. It's just not the vaccine. As we get further along away from New Year's Eve, as we get further away from Christmas, from Thanksgiving, from the Halloween parties that I did not get invited to, FYI, for next year. But as we get away from those parties and those get-togethers with our family, we're starting to see a reduction there. So the social distancing works. So what I'm concerned about as we talked to our physicians this week is it's not just finished and COVID's not over. We didn't turn a light switch off and COVID went away. So I encourage you to wear your mask. I encourage you to wash your hands, social distance. This is a long fight. This won't be over. We expect spikes in the next few weeks. We expect to go back. We're not going to close down our COVID rooms because we don't need any more and put everything back together. No, we're going to continue to add infrastructure into the hospital to prepare for the worst, to prepare for more, to prepare for this happening again. So we appreciate your help. We look forward to working with the community to ensure that we're providing for Northeast Texas a very safe environment to receive health care. As we talk about the numbers and we look at the region, Titus is back at 1524 on the 25th. So again, I think most of the regulars have seen this report, and we're a couple days behind on it. But as of Monday, when you look at the 25th, we're at 1524. So staying around that 15% range. We're still monitoring our elective procedures every day. We do our bed commander meeting at 1:30, and we go through our procedures, and we're still right about that 15% requirement. When you look to our south and look at the Tyler area, and you still see them at 20.6. It's going down, but it's still, it's not just going away. And after Saturday, back up Sunday, Monday, Tuesday, you can see that number hovering around us. And in Dallas, the same way. Still that trend, still the plateau going, but you can still see it's just not going away that quick. So we are continuing to see COVID. We're continuing to see patients. We still have patients on ventilators. We still have people coming into the ER who need assistance. When we look at the specific numbers as of yesterday, where we finished as of last night, 167. So we've been right at 161, 167, 67 for the last few days. The one that I got excited about this morning was when you saw the ICU beds, and it went down again, down to 52. So from 65, 63, 54, 52. So even though the hospital beds stayed the same, we decrease the number of ICU beds, and we have more ICU beds available. So that means maybe the sickest of the sick are getting a little bit better as we fight this. So continue to keep up our guards, keep up working. In the Tyler area, you can see kind of the same trend. Over the last few days, it stayed about that 504, 505. The 135 in ICU beds down to 132. So as you can see that still the same as we see here in Northeast Texas, you're seeing in all of East Texas. This is the Dallas region, still staying at that 3,500 plateau, going down a little bit. You did see on theirs, which was interesting, the peak up and almost to 900 ICU beds after being in the 850s and 870s. So why do we watch that? Why do we care? We're about a week behind Dallas normally. And what we saw in the second surge and third surge, in the first surge, we were by ourselves. And it was just us going through that first surge. But the second surge and the third surge, we were about a week to 10 days behind Dallas. So that's what concerns me a little bit when we watch this. We continue to keep those numbers in front of us to make sure we're doing everything necessary. Don't think for a second we're going to stop fighting this. Don't think for a second we're going to just go back to normal, because we're not. We're going to pivot. And that will be the phrase that you hear probably this entire year is pivoting. We're going to have to be nimble and move in different directions. The vaccine's a perfect example. We're giving the rest of our second dose will be given out today. We'll give out up to 687 doses of our second dose. We'll keep 20 for Monday because we had our original dose was over 3 weeks that we did it. So we have 20 more that will get their second dose on Monday, and then we'll be finished with all the doses that we have here at Titus. That's 1,400 first dose and 700 second dose. I appreciate the work that Judge Lee and Chief McCray are doing with us to try and get more for this area. We are pushing. We're sending the necessary information, making the phone calls to try and get more vaccines into this area. So I appreciate your patience as we go into it. I know Johnson & Johnson's fixing to have theirs come out. It's very interesting. It's going to get real confusing. And for some of the puzzle people and the strategy people, you love to have coffee with me, social distance, of course, and talk about how you're going to manage first shipment, second shipment. I talked to the Rotary Club yesterday here in Mount Pleasant. Great question about that is, what if you get Pfizer? And what if you get Moderna? What if you get the Johnson & Johnson? That's going to be something we're going to have to prepare for as a health system and a community. We just want the vaccine. And I think that's what we're pushing for. And we'll figure out the logistics to get it out there as quick as possible. A comment was made just before we went on air, and I just want to pass it on to you. I want to thank the Northeast Texas community. You've been patient. I know the vaccines aren't coming out as fast as we want, but at 1,400 vaccines, we're way ahead of most areas our size. But the people we call and just the people who are getting on the list or sending me texts or sending my friends texts, how do you get on the list? Everybody's being very cordial about it. And we truly appreciate your patience. We know it's not easy. We know it's scary. And especially as we've seen friends of ours, family members, members of our churches, members of our inner circles who've passed away over the last few weeks, it's even scarier. So I appreciate the patience and just the kindness that the community is showing. Help There Tomorrows start here. That's our website, titusregional.com. That's where the waiting list is. Tell your friends, tell your enemies, tell everybody. Get them on the wait list. We're going to work with the state, and hopefully we can take that and do some more things with it. And that's what we're looking forward to over the next few days. We've got some phone calls set up and some meetings set up to try and expand the vaccines in this area. And as we get our first dose, we'll get it out there, and we'll go down that waiting list and try and get that out to the community. I want to emphasize as the numbers still continue to decrease, and I hope Friday we'll join you early Friday morning. I think probably do a 10 or 11 sometime Friday morning. Please watch Facebook. But we will continue to do this Monday, Wednesday, and Friday. I'm going to continue until we get down to the onesies and twosies and until there's nothing to report. But we're going to do it early on Friday, and hopefully by then we'll continue to see this decrease. We truly appreciate your support of our health system and of our community. God bless.